Do you suffer from Hashimoto's thyroid disease? Do you suffer from hypothyroidism? Are you feeling fatigued? Do you feel that you can't sleep? Do you also have pain, possibly pain that you're experiencing in your extremities? Are you having problems going to the bathroom? My name is Dr. Lonnie Herman, and I'm going to share with you a patient experience in this video. A patient who is a middle-aged male who found me online, like you, who is going through a program with me. He's been with me for close to 2 months right now, and following some protocols that are helping him not only find and detect the causative agents that are making his body diseased and making his Hashimoto's thyroid condition occur, but it's also strategies to remove those causative agents. And this man came in today after his third visit with me. Today is August 21st, 2015, and he said, Dr. Herman, I'm going to report to you now, I am feeling I feel like there has been a lump in my throat. One of his chief concerns was a lump in his throat. He feels it decreasing, an incredible decrease where he could swallow and barely notice that that's there. He noticed that the head pressure, he had a chronic, I shouldn't say chronic, I should say this was acute, but it's been going on for a little bit longer than he knows me within the past year. He said that the head pressure is lowered by 50 to 60% after his last protocol, which I'll share with you what that was. He had a chronic arm pain that's been going on for quite some time. He said it felt like a bone pain in the upper arm, down 20%. He had pain in his right thigh that had been bothering him for quite some time, that was making it very difficult for him to walk. He said that thigh pain is down 30%. And he also said that the foot pain and the calf pain has gone down 20% after his last protocol. His last protocol, we found that his weakest tissue, his weakest cell in his body was the oxygen-containing part of his red blood cell. We found that his hemoglobin, it's known as, which is the oxygen part of your red blood cell, he was loaded in there with multiple parasites inside the blood cell. He was loaded with tobacco smoke, secondhand smoke. He's not a smoker, never did smoke. Mold was in that blood cell. Multiple forms of intracellular bacteria and intracellular parasites in that blood cell. He had mycoplasma bacteria inside his blood cell, causing a stress to the hemoglobin part of the blood cell. Bartonella henselae, a terrible, serious inflammatory bacteria inside that blood cell, damaging, weakening his hemoglobin. Multiple foreign substance chemicals that could be in the air, things from nail polish that maybe he was around in a place where nails were getting done, or jet fuel that can come out of the sky, to petroleum maybe from somebody's exhaust while driving down the street, to a number of different possible agents like pesticides and things that are in our everyday life in this world. Borrelia burgdorferi bacteria, the causative Lyme disease bacteria inside, damaging, weakening his hemoglobin. He also had the BHT preservative that's found in some cereals, at least that's as far as I've studied to see where that's coming from. And he has side effects of the measles, mumps, rubella vaccination, damaging his hemoglobin. He also had electromagnetic field stresses, damaging the red blood cell, weakening it. And he followed a protocol that took about 2 weeks to get through that protocol. We also found that his hybrid car, the electricity from that hybrid car was damaging his DNA and his red blood cell, and we had to make remedies for that. There was a way to actually remove that electrical stress from the human tissue where we can find it, with a very unique form of homeopathic remedy. His next round, we found that his hemoglobin still had a bit weakness, but there was parasites within his lymph and cadmium metal within his lymph tissue. Now, today was very interesting. Today, August 21st, 2015, with his more recent update of how much better he's feeling, and there has been no thyroid pills or no enemas that have been performed. There's been no dental tooth removal or mercury removal. He has no mercury. He does have a root canal in the mouth. But we did find today that his weakest tissue, his primary tissue that needed to be addressed in his body, was his liver. Now, the thyroid needs to use the liver in order to turn the thyroid hormone. The body, I should say, not the thyroid, but the body uses the liver to make thyroid hormones become activated. That's part of our normal physiological function. Well, his thyroid is not working right, even with taking Synthroid for a very long time. He still has very high TSH levels, very high thyroid antibody levels, and very poor body function, and walking has been a problem, and various symptoms going on in his body. In his liver today, I found that multiple vaccinations are harming, side effects of those vaccines are harming his liver, toxic mold in his liver, phthalate chemicals damaging his liver, parasitic flukes inside his liver causing stress, the Borrelia burgdorferi bacteria, the causative agent of Lyme infection, Lyme disease, inside his liver, anahelminthic worms inside his liver, tapeworm inside his liver, Diphyllococcus parasitic infection in the liver, Blastocystis hominis inside the liver, Giardia parasitic infection in the liver, 2 schistosoma parasites. Schistosoma, I'll put a B and an M. There's a long name for that. I'll look those up and give you that exact name on this video. Herpes zoster virus in his liver, antibiotic residues in his liver. The examination didn't stop there, but I'm going to tell you for today, but all of these different parasites and chemicals and mold, and so they have to come out of that liver, and they will be done. Each individual parasite and toxin, we're making an exact duplicate copy of it, where we will take a remedy of that copy of the infection and toxin, and it will specifically target the infection or toxin inside the liver and remove it from the liver to make that liver replenish itself and function better and be less stressed, and help his thyroid, help his body manufacture normal or closer to manufacturing normal thyroid hormones. There's more to it with his body. In this day today, his next weakest tissue, his next most stressed tissue, the next priority that had to be dealt with after his liver was the vas deferens. That's in the reproductive system. You've heard of a vasectomy that a male gets, so that no more sperm is going to come through the ejaculatory duct. Well, his vas deferens, we found tapeworm again in that vas deferens. It was not only in his liver, but it was also in the vas deferens. I found in his spermatocord with my unique bioresonance testing, we're able to find which tissue is the weakest, which tissue needs help, and which agents are in there causing that tissue harm. The spermatocord, we found Babesia microti parasite. I found Bartonella henselae, a harmful agent in there, Mycoplasma bacteria, and protozoa eggs, all infecting that sperm area and infecting the testicles. So he's going to be getting remedies, or I delivered those to him today already, remedies and following a protocol to get rid of all of those infections inside his reproductive system that will help his body function better, because even when your reproductive system is infected and inflamed, you have inflammatory mechanisms that are going to be going all throughout your body. There is no way that if and when a male's reproductive system is infected that the rest of the body could feel okay. It's just not possible. Everything is going to be dragged down by the weakest link in the chain, the weakest tissue of the system. So it all has to be relieved. I'm going to see him again in 2 weeks. I'm going to tell you one more finding with him was that fluorescent light stress on his tissues, and the fluorescent lights, he says, I don't have any fluorescent lights. There's none at work, there's none at home. And I asked him, not the long fluorescent lights. What about those new screw-in bulbs that are supposed to be the energy saver bulbs? When you look inside, it's got a coil-looking spiral light bulb inside the actual bulb frame. And he said, yes, I have those all throughout the house. They're energy savers. I said, those are fluorescents, get rid of them. Those lights have mercury, potential to have mercury emitted from the bulb that can be poisonous to your tissue. And those lights flicker, fluorescents flicker at a very high pace. That's not natural for the human being body. They stress the DNA, they can stress the brain, stress the immune system, stress all the tissue. They can cause fatigue, they can cause insomnia, they can cause a number of different things. So he is ordered to change those light bulbs inside his house. I'll be seeing him again in 2 weeks. I'll report some updates of the way he is experiencing relief of his symptoms and his next round, what we're going to find in the follow-up visit. We're also going to find that we've cleaned out this liver if there's anything left over. I look forward to helping you. Share this video with one friend. I look forward to helping your friends. There is a way to get through this chronic disease called Hashimoto's. There's a way to get relief of these different symptoms that you suffer from when the medication just hasn't worked. And following a gluten-free diet or dairy-free diet just hasn't resolved all of your symptoms. There is a way to figure it out, and I'm here to do it for you and with you. Subscribe to my YouTube channel, share this video with a friend, and like me on my Facebook page. I put up information on my YouTube channel all the time. You'll be first to see it as I put it up. My Facebook page, I'm constantly putting up information. And call to make an appointment here to look forward to your first step to get your life back and get rid of your symptoms and live your life the way you expect it to be functioning, living with health. 954-370-3100 is my clinic phone number. You call, my assistant will be very happy. She's very nice and very happy to help you and answer some of your questions and get you set up with an appointment here.